Radiation therapy is a mainstay of cancer treatment and now is targeted with greater precision so that patients have fewer side effects. Physicist Dr. Bauchaib Rabbani at the Robert and Beverly Lewis Family Cancer Care Center at Pomona Valley Hospital Medical Center reveals the innovations that have dramatically improved the effectiveness of radiation treatment.
So radiation has been progressively improving over the years since the inception to today. We have now devices that we can almost treat the entire body. Like this machine that we have here is called tomotherapy, and it's going to be essentially we put the patient on the table, and the patient is treated in a helical manner. That means the patient is moving and the beam is being delivered at the same time.
Dr. Rabbani discusses his role as a physicist in radiation therapy.
The physicist's job is to work together with the radiation oncologist. For first is the machines that deliver the radiation have to be calibrated and measure the output to see that whatever dose we give into the patient is accurate and precise. So there are various ways that one has to do that. First, you have to know how the machine works, how to measure the dose, how to deliver the dose, and how to project the dose. So all of those things are the physicist's job to make sure that those are all correct. So when somebody says, I gave him so much radiation, we know exactly what that is. And the physicist is the only one who can do that.
Dr. Rabbani outlines the process of determining the treatment plan.
So the first thing that the patient, once they present themselves, because they already have been diagnosed with some sort of a cancer, they come to us, they see the physician, then they see whether the disease is localized. That's one primary thing, that there are some spots that we can treat with radiation. Then once that decision is made, and also the decision is how much radiation is given, and that's the physician's role in that one, then they go to what we call simulation, where we take them to a CAT scanner, or maybe even some other device like MRI or PET-CT, to find exactly the limit of this disease that we want to treat. Once that is done, then it goes to physics and dosimetry, and a plan is generated.
Technology has allowed the cancer care team to precisely shape the treatment at the tumor.
What we have is what's called Imrt, Intensity Modulated Radiation Therapy. It allows us to, knowing what the tumor looks in a 3D, to deliver the dose exactly where we want it and how much to each spot on the tumor. In addition to that, we now have what we're calling precision therapy, which is we also know the position of the patient. One of the major things is to know where is the tumor at any given time. So we have now ways to monitor the position of the tumor in the body and to target the dose only to that area, not to treat anything that's normal around the target. A lot of changes have happened to radiation oncology, both hardware and software. It's like a day and night between what it was and what it is today, with the precision that we have and the manipulation we can do. So both hardware and software have really given us a lot more to work with, and different modalities. We can treat with electrons, we can treat photons, we can do with the X-rays. There are some other ones that do proton, and there are other elements that are available now for treating patients.
Radiation treatment is more effective now than ever before.
I think radiation is playing a major role in the survival of cancer patients. It has been much better because, again, because of the beauty, one of the problems with the early radiation was the side effects. And the side effects was caused by the fact that we treated normal tissue surrounding the tumor. Now with the focus on target only, with a little bit of a margin around it to do microscopic, we are much better to give the correct dose and the amount of dose to the tumor. So there is survival is very, very good, and the side effects are minimal nowadays.